Welcome to my channel, Unknown Radiography. Ladies and gentlemen, today we're delving into the intricacies of capturing the glenohumeral joint with precision using the Grashey method and its close cousin, the Apple method. These techniques are crucial for revealing the joint space between the humeral head and the glenoid cavity, shedding light on potential pathologies and helping us provide accurate diagnoses. Position of patient. Firstly, let's consider the position of our patient. You have two options here, the supine or upright position. However, the upright position is not only more comfortable for the patient, but also aids in the accurate adjustment of the part. Comfort is key, my friends. The Apple method is similar to the Grashey method, but uses weighted abduction to show loss of articular cartilage in the scapulohumeral joint. Position of part. Center the IR to the scapulohumeral joint. The joint is 2 inches 5 cm medial and 2 inches 5 cm inferior to the superolateral border of the shoulder. Rotate the body approximately 35 to 45 degrees toward the affected side. Adjust the degree of rotation to place the scapula parallel with the plane of the IR. This is accomplished by orienting the plane through the superior angle of the scapula and acromial tip, parallel to the IR. The head of the humerus is in contact with the IR. Abduct the arm slightly in internal rotation and place the palm of the hand on the abdomen, but for Apple method. The patient should hold a 1 lb weight in the hand on the same side as the affected shoulder in a neutral position. While holding the weight, the patient should abduct the arm 90 degrees from the midline of the body. Central ray, perpendicular to the IR at the level of the coracoid process. Now for the grand reveal, Figure A shows AP oblique projection, Grashey method with shoulder showing normal scapulohumeral joint space. And Figure B shows AP oblique projection, Apple method, with weighted abduction showing loss of articular cartilage, arrow. In conclusion, mastering the Grashey and Apple methods is like fine-tuning your artistic skills. Pay attention to the details, create harmony between the patient and the equipment, and you'll unveil a canvas rich with diagnostic information. Thank you for watching, and don't forget to like, share, and subscribe for more videos. Also, if you have any questions or suggestion, please drop a comment,